This is Dr. Vasquez. And one of the areas that we're trying to improve again is showing you some of the things we developed that really benefit patients and also the GBUAHN organization. So here, if we're looking at the GBUAHN app, which could be downloaded, there's a lot of information on the website and also on the App Store. So once they click on this, they go into the app. It has a lot of different things. So call us, directions. And I'm going to go through each one of these to kind of give you a better idea. It's an interactive app in addition to be integrating with using features of the phone. So if you hit call us, it's going to directly start calling GBUAHN. But the other thing is, if you're looking at directions, and when you click the directions, it's going to lead you right to a map and how to get to our direction. Okay? The other thing is, tell a friend. If you connect to it, it's going to give you access to either emails, you can push it out, Face, tweet, SMS. So it lets you kind of use the app a little bit more effective. The About Us section here basically has a lot of things with regards to our website, what the home is, who the corporate members are, and a lot more information on some of the things we do. When you get into the doctors, it starts to map out the different, if it's PCPs or behavioral, and you can pretty much pick your choice, and it narrows it down, and it clicks into the different providers in our network. When you, and if you want just PCPs, that's what you're only going to see within that range. And we've grown since this. Now, when you're back here, the next one is the phone, and this is a nice one because if they have any of these issues, so if they were to click the emergency, just connect right to the phone number. So they don't have to look up the numbers. They'll go directly there. With regards to the next one is the actual patient portal. They'll guide them to the website with a lot of tutorials. And then at the bottom, when they press, they get right into the portal, and they can access their electronic medical records. Good way for the PHNs and the rest of people at GBUAHN to really communicate with the members. And it's a secure environment. And again, all going back to MedDen. So that's why it's so important to activate the portals and also know how to use them effectively. But this is the way into the portal itself. Now, once you have that, you can hit the more buttons, and now you've got the handbooks, and we're going to go through most of these. Now, the handbook, when you click into it, it's going to give you either member handbook or the brochure. We'll click in on member handbook up here, and that's what we have, the whole PDF, and it's a nice way for members to get access to it. It's a nice way for the GBUAHN staff to know what's in those member handbooks. So it's actually really good. So we go back, find us. Again, if they were to use this, it would track it. It would actually GPS them in. When we get into the area of health and wellness, we've got the health Encyclopedia, which we built in, and also some of the preventive guidelines, which are key to managing some of these patients. So if you click into the Health Encyclopedia, it'll actually jump you to our website, where not only do we have it on apps, but we also have it on the website, and patients can get nice tutorials in different languages that can benefit them. Now, the preventive guidelines, some of us are a little confused, and they, some of the PHNs, CHWs, or some of our members say, well, I don't really know what the guidelines are. So here with the preventive guidelines, we try to break down the most important ones, at least for now. When you click on this aspect of it, you'll see the different ones. And if you're able to click on any of these, you go to the next level. And this is for colorectal screening. And you get a nice description of who should get it and of the age groups. And it starts to kind of clarify what we should be doing with a lot of our members. Now, the other piece is in terms of the contact us. Here, we're on Face, tweet, blogs. We're all over the place. So at least you're giving access to the patient to be able to get some information to us. In the news, we have a lot of things that are going on that are really practical. And we've narrowed the search engine more to medical so that a lot of things that are coming up, at least patients can keep up with. When you get down to the share your experience also, they can, if they don't want to write something, they can actually just talk it, and we get access to that information too. The last piece is the updates, which is nice because the updates, not only do we update the app, but we also push out a lot of information. And so you get notifications at the app level. And when you press on this, you're getting a lot of different things that we pushed out. So whether it's video, website information, emails, I mean, it's a plethora of information we can push out. And when they click on this, they can actually see it. And a lot of it can be video tutorials that we pushed out on goals. And what the patient can do is they can also click and spread the word out. So this is all really good for what we're trying to accomplish at GBUAHN. Use the app. It's actually very productive yourself, and then also make sure as we're developing a format to deploy phones, government phones to patients, if they have smartphones, let's see if we can get some of these apps out there. Thank you very much, Dr. Raul Vasquez.